Good afternoon, everyone. I'm Petra Wolfbeis, the Director of Membership Services with the Association of Municipalities of Ontario. Thank you for joining us today. This is one in a series of AMO's COVID-19 webinars, and I have the pleasure of once again introducing both Jane Albright and Monika Turner, who are here today to discuss pandemic pay. It should be an interesting conversation. I'm sure many questions and interests in terms of what you will hear today. Monika Turner, who is my colleague, is the Director of Policy with AMO, and I'm sure many of you are aware of Monika and have worked with her. Jane Albright, who has been a fantastic partner with AMO through OMHRA on a number of COVID-19 webinars, is the Commissioner of Human Resources and Citizen Services with the region of Waterloo, and she's also the President of OMHRA. So I will leave now and turn it over to these very capable and interesting women for a great conversation.
Thanks, Petra.
Thanks so much, Petra. So welcome. I see there's about 120 joining us, so thank you. We are going to do our very best to give you as much information as is available. And there's going to be a couple of places we say we don't know and refer you to some websites. So what are we going to cover today? Next page, please. There we go. So it's always good to say, what are we going to do? So you'll see we're doing the who, what, where, and we will walk this through. I think we're also going to be talking at the very end about the recent Employment Standards Act changes as well. And then Jane and I are happy to do our best on questions. So next page, please. The caveat. It's actually been described that what we're about to do is brave. Actually, I'm trying to, or we're thinking of it as we're trying to provide as much information as we have available to us, that's public, to municipal employers. This is a complicated program. It's still in the process of being rolled out, but some things to know is it's a provincial program with federal funding. We'll get to that because that's going to have a number of accountability issues. It's two governments that want to know what another government has done with the funding. Jane and I are messengers. We are trying to provide you with information, and now and then and during the questions, especially with regards to eligibility, we'll continue to try to remind you not to shoot us because we're simply trying to provide information of the from the province. We're also very aware that the province has not provided yet a webinar on the entire program or even detailed webinars to service managers or to any of the employers. They do have a website, which we've referred to a couple of times in our updates. I checked it an hour ago just to be sure, and they haven't updated it since June 2nd. So as we get closer, please check their website, but we will do the best we can with the information we have. So next slide. What is pandemic pay? So it is a temporary program, again, through the province. It's aimed at helping some frontline staff who are at heightened risk during the COVID-19 outbreak for a defined 16-week period. So I will say, and we'll probably come back to this a couple of times, this was originally as it was being described by the Premier, for employees that are such as PSWs and cleaners, those that were being paid at minimum wage and were at exposed risk to COVID. That was the original design. It has changed in some areas, which we'll highlight. So there's two types of pandemic pay that employees may be eligible for: the temporary top-up of $4 per hour based on hourly wages and monthly lump sum payments The lump sum payment area is complicated, but we'll do our best. So again, the work is only for 16 defined weeks, and that's from April 24th to August 13th. They will be giving retro money, so it will go back to April 24th. So the work performed on and after April 24th will be eligible for the hourly pandemic pay and will count towards determining eligibility for the lump sum payment. And again, this is funded through a provincial federal partnership, a value of about $287 million. And the province is accountable to the federal government on the use of the funding, which again will explain why some of the reporting and reconciliation requirements will be there when we see them. So next page, please. So again, all of this will be recorded and our slide deck will be available. This is all information that's on their website, but it is regarding the lump sum payment. These are for employees, eligible employees that work at least 100 hours in a designated 4-week period. They'll also be eligible to receive an additional lump sum payment for $250 for that period. You'll see the 4-week periods, and I know a number of you will say, but those aren't our pay periods. We'll get to that. So over the 16 weeks, if someone's been working full-time or at least 100 hours in the designated 4-week period, they are eligible up to $1,000. So again, this one's going to be more complicated. This is it in general, but it's based on all hours in a designated week by eligible employees in eligible workplaces, including overtime. And especially for paramedics and such, we often have paramedics that may be working for 2 municipal services. So they are looking at that. And you may also be facing some in long-term care that did originally work for 2 places. And so again, there's retroactivity. So going to who's eligible in the municipal sector. Brittany, could you? Yep. So this is probably one of the most challenging areas. So we will do our best in answering this, but I just want to start off by saying they are being very clear that it only is for those that have a eligible workplace, an eligible position or designation, and that it is frontline. That is to say that you are working in those areas where you may not be able to physically distance as you should with COVID. So there is a risk of exposure. We've had lots of questions about what about those that are taking the first calls in a call center. Our understanding from the province, and again, it is the province that is determining the eligibility rules. I'll keep underlining that. But it is only those that may be exposed in those positions where they've deemed it to be eligible workplace and an eligible position. And we'll get to all the nuances that we know of at this point. So for public health, they are saying it is only, you are only eligible if you are a public health, an infection prevention and control nurse. Jane and I have asked many, many times, well, what about deployed public health employees? What if you are a public health inspector, you're standing side by side with a public health nurse and you're doing swabbing of people that may have COVID? The answer at this point is no, it is only nurses that are frontline. Now, the province is more than aware of that question, the fact that there have been a number of folks that are not nurses that have been put in, deployed into positions that would expose them to COVID. So they're aware of that. They may come back with a different answer, but this is our answer at this point. For paramedics, it is primary care and advanced care paramedics. And again, full-time, part-time, casual, and contract, because there are some contract folks. So again, it is for the different range. And even if you've gone and hired from a service provider for a paramedic or any of the other positions, they're eligible if they fall into these criteria. For long-term care, all non-management publicly funded employees and workers. Again, I know that the Ministry of Long-Term Care may give us more information about that, but they are very clear that it's non-management, and actually that's clear for all of it, and I'll get to that. But again, full-time, part-time, casual, and contract. Now, the next slide talks about the most complicated for at least the municipal sector. And I should say, for the municipal sector, we're the only ones that we span 3 ministries, 4 different programs. We've again said, will there be an integrated template and such? We've been told they're mindful of this. They don't want to increase our administrative burden. They're mindful of it, but we haven't seen the materials yet. So who is eligible for housing and shelters? Again, it's matching the workplace with both the workers. These are their definitions, and I know you're going to ask, well, what about case managers? What about this? What about that? And I'll get to who's not eligible. But so for the municipal sector, pulling out from the provincial website, emergency shelters, supportive housing facilities. And again, I don't know if they're categorizing seniors' homes that municipalities run as supportive housing. They need to answer that question. Drop-in centers, temporary shelter facilities such as community centers and arenas that have been repurposed, and hotels and motels used for self-isolation or shelter overflow. Again, these are all workplaces where you are working with people directly, and you may not be able to be away by 2 meters. And yes, it's expected you're wearing PPE. We will not even touch PPE in this call. And then the eligible workers, again, these are their definitions: intake and outreach workers, clinical staff, housekeeping staff, security staff, administrative personnel, maintenance staff, food service workers, and nursing staff. Again, frontline are doing direct patient or person contact. Next page, because I think this is where I'm seeing some questions popping up. We will answer the question, but we'll keep coming back to the people that are not eligible for this are management, which is probably the bulk of the people on this webinar. We have asked, and again, I'll say Jane and I and others have asked this question. We have talked about frontline work done by management in long-term care and public health and paramedics. We've even asked, what if there's a paramedic, one paramedic who's a supervisor is unionized, one is not, both are doing calls with people? And the answer we have received from the province is management is not eligible. So again, its eligibility is not dependent on the fact that you've got an outbreak, but rather the risk of exposure to COVID. And again, to receive this provincial program on pandemic pay, you must work in both an eligible role, be an eligible worker, or a workplace. And and I need to do a caveat here, because I know that there may be some that have already started this program, or may feel that the program, someone should be eligible and you start to pay if the province says, no, that person is not eligible, the municipality or the DSAB will be responsible for funding that. So again, I can only underscore, and I have a feeling there might even be a provincial person or two on this webinar. This is a provincial program. They deem who's eligible. And if you're trying not to expose your municipality or DSAB to additional costs, you may not agree with the eligibility rules, and we can talk about that. But unless your council says, yep, go fund those folks not eligible, it would be our suggestion you don't, unless you have approval to do that. So that's all good to know, and you may be gnashing your teeth. But so on the next slide, and again, this will be, this is on the website. You just have to find it. It's buried in a deep link. Who do you call? We actually asked for a 1-800 number. You know, sort of like Ghostbusters, who you call. But what we did get were email accounts. Don't know how fast they'll respond. They are still bound by corporate government time for response, which I believe is 3 business working days. But for eligibility, here are the emails to contact. And if we can't answer the question, and again, our answers today are based on our information at this point in time. There may be some changes. We have seen the province change eligibility in the sense of respiratory therapists were originally part of this. They're now part of it. So know that we have been talking a fair bit with the province as they've been designing it. They haven't done, in some areas such as housing and shelters, I know they have at least bounced details off with service manager providers, again, just to get an idea of who does what. But again, it's the province that makes these decisions. So if you are unclear about who is eligible, and it doesn't, it's not clear even as they start rolling out the money, here's the information that you should follow up. So I've talked enough. I'm now going to turn it over to Jane on the how.
Thanks, Monika. If we could move to the next slide, please, Brittany. So in the week of June the 8th, ministries are going to start sending the funding details to employers that receive funding directly from government, as well as service delivery managers via their transfer payment agreements. We understand that the funding allocation will be done in 2 batches, and this is probably the how/TBD slide, because there's a lot of things that they're going to provide more information that follows. So the details will follow from each of the funding and program ministries. There will be reporting templates and reconciliation processes. Again, as Monika said, we have encouraged them to have one process and one template in order to facilitate ease of this. They've indicated they've heard, but we don't know what that's going to look like yet, and there will be further details that will follow. We understand that the Ministry of Health is going to try and streamline the process for employers that have both public health staff as well as paramedic services. Next slide, please. So what we know are that the temporary hourly pandemic pay and lump sum payments are considered non-pensionable earnings because they don't form part of the base salary on an ongoing basis, so OMHRA will not recognize it. They are not part of an employee's base salary and have no impact on benefits paid by employers. So we understand that this funding will include the employer's share of mandatory contributions, but there will not be any administrative funding for employers to manage this process. So any type of additional supplement to bring staff in to help manage this will not be paid for. The $4 hourly top-up and lump sum payment eligibility only apply to the hours worked. It does not apply to time not in the workplace for any reason, including vacation, any authorized paid leave, including sick time, time and benefits awarded under WSIB. On May the 30th, the province announced an emergency order allowing employers with unionized workforces to provide pandemic pay to employers, to eligible employees, without the need to negotiate separate terms and conditions with their bargaining agents. And if we go, so for the sector, when might we see things? For healthcare, so public health and EMS, the week of June the 8th. Starting of rollout to funding to employers the week of June the 15th. The start of rollout to payments to employees will be dependent on the employer. Long-term care, same timing, week of the 8th for rollout of agreement to employers, the rollout of funding to employers, but again, will be the rollout to employees will be dependent on the employer rolling it out. And same with emergency housing. So the same for all three of the different programs or different ministries. And again, you know, many people are holding off to get all the eligibility to make sure that municipalities are not on the hook for any of these costs, particularly when some of these payments need to be flowed to agencies so that agencies don't receive the money and then the municipality has to fund it. So we wanted to put in a little bit of a plug on the changes to the ESA, which thankfully are much clearer than the pandemic pay information. So on Friday, May the 29th, the government published a new reg under the Employment Standard Act that intended to provide temporary relief from the termination severance provisions. So many of us knew that the 13-week break in service would not draw any severance calculations or severance pay for staff. This supports that 13 weeks can be extended as a result of COVID. One of the things that they've done is they've identified changes to the infectious disease emergency leave. So people who have a change in hours or people who have a change in pay as a result of COVID become a new group eligible to be deemed on IDAL. Deeming certain employees not to be on layoff. So the layoff provisions change that this is a temporary thing. People will not be held to be considered on layoff after the 13 weeks, and deeming certain actions not to be constructive dismissal. This doesn't mean if for other reasons people file that they can't be considered to be eligible to seek constructive dismissal changes, but it means that if it's as a result of COVID, this is not going to be entertained. It's important to note that these are for management and excluded positions. The unionized positions still fall under the Essential Services Agreement with reliance on the collective agreements. People have to honor the provisions in the collective agreements as they have any temporary leave provisions or temporary layoff provisions. Those need to be honored, and this is for non-union staff. So with that, we're opening ourselves up to questions and are optimistic that we'll be able to answer them. I will tell you that on the ESA, Hicks Morley has done a brilliant document that outlines the details and a lot of the information around it. That was a 50,000-foot view on what that looks like, but Hicks has done a fabulous job on their FTR. So we can make sure that link is available as well.
So Jane, how about, we're getting an echo, but why don't, I'm going to start with the Q's and A's,
Okay.
those that are the more HR, labor relations, which is your expertise. I'm going to ask you to answer, and then I'll just answer the eligibility because there's lots of them. But the question from Kim is, can employers use their regular pay periods that fall closest to the designated dates for the 16 weeks? So I guess that's the question. What if the pay periods don't match up? Do you have any advice for people on that?
So I think that you have to do it in closest approximation to when those timelines are. We have asked whether or not there will be any ability to see flexible, to be flexible around that, because people are going to have, you know, for lack of a better expression, using my, you know, my printing, you know, widows and orphans around the pay period. So we're hoping that those can be recognized, but they need to be reconciled within their pay period unless they give provisions that they can be extended afterwards. Yeah.
So I'll go to the next one. Are primary care paramedics on light duty in the office or cleaning trucks covered? It is our understanding that no, they're not, because they're not going out on calls. They're not being at, they're not getting a potential of a live person contact with COVID. Next question, would a charge nurse be considered to be non-management? I'll be honest, we can't answer that question. That would be one that you can give to the Ministry of Health. Because again, the different grades of management and the fact that many of our managers actually are doing frontline work, we have raised, but you would need to go into the specifics. And I assume that would be, again, I can't assume whether that's housing or such. So I'm just going to leave that one. Copy of the PowerPoint will be on our website as opposed to sending it out to all attendees unless Brittany tells me differently. And long-term care, they're talking about frontline, they're people that are actually in contact with the residents in a long-term care. So if they're office staff, but they're also exposed, again, that is a question for the Ministry of Long-Term Care in how they work it through. They've got a much longer list of what is eligible or not. So I'm going to go to Zoe's question, where again, you've got someone who has their primary care paramedic license, but they're in a management position. We've asked this question many times. The answer that we keep hearing is no. It doesn't, if they're management, they're not eligible. And we'll keep saying that. Again, the provincial rules, and as we said in the caveat, please don't shoot the messengers, because all we're trying to do is at least put it all on the table for all the programs in the municipal sector. Next question is, if an employee works in a dual role as a dietitian 2 days a week or as a supervisor 3 days a week, are they eligible or not? And if so, is it only the 2 days they work as a dietitian? Our best understanding, if the dietitian role is eligible, it would only be that. But again, you will get clarity. And this is a good question, anonymous. I wonder if that's someone from the province. Just to say, we did get a lot of questions about, well, what about municipal? Because it didn't say municipal. Municipal governments who operate ambulance services are eligible employers, just like we are, because we also manage and run long-term care. We also do supportive housing and shelters, and we also have a number of health units within municipalities. So again, paramedics and public health, for whatever purposes, were put under health. And they are in the minds of the Ministry of Health, but they are cost-shared programs with the municipal sector, and they are municipal employers in some situations. And with paramedics, you also have DSABs that run paramedic services. They are also eligible. So we've got, again, emergency tech assistants who clean and sanitize and restock the ambulance. Again, the answer we've received from the Ministry of Health is no. On the issue of a municipally owned health center where facility maintenance staff are municipal employees, would they be considered an eligible workplace? Need to check with the Ministry of Health. They haven't talked about CHCs to that degree, and I didn't see them in any of the website information. So that would need to be a specific question to the Ministry of Health. So the question about an employee that works in multiple facilities, I hope they're using good PPE and infection prevention control. But if they're not healthcare related, do they only get pandemic pay for the time spent in a healthcare facility or all their hours? The answer is it has to be an eligible healthcare facility. And yes, it would be only for those that are in eligible positions and an eligible workplace. And again, the province needs to confirm these issues, but overtime, does it count as an hour? That's the way it reads, just basic English. But again, they need to confirm. And I guess the person who's anonymous isn't from the province, which is good to know, but just tried the Ministry of Health inquiries and it just bounced back. That's really unfortunate. And when I get off the webinar, I'll be happy to share that with the Ministry of Health. Maybe happy is not the right term. Jane, what does the quote, no impact on benefits paid by employers refer to?
That would be salary-based benefits. So your long-term disability and short-term disability, the payments that people would get if they go off on those leaves would be reflected of their base salary, not this additional salary. So it wouldn't impact health and dental, anything like that. These would be salary-based benefits paid by employers.
The next question is, will the province provide an attestation form or template for employers to send out? Our understanding is that they haven't shared the templates. We've been asking for just one template so that a municipal employer isn't filling out 4 different types of forms, but it's our understanding that it's completely the provincial program and they'll be providing these forms. Is that your understanding, Jane?
Yes.
And question, what about team leads in long-term care, social services, and public health? Again, I have to keep saying, if they are deemed to be management, whether they're unionized or not, the answer will be no, that we've been told. If they're not deemed to be management and they're doing frontline work with possibly COVID positive patients, the answer should be yes, but for greater detail, ask the appropriate ministry. Regarding ESA layoff amendments, do these provisions apply to unionized staff where there is no layoff language within their collective agreement? Over to you,
No,
Jane.
the provisions have been very clear that these are for non-union staff. So you would have to develop some type of a process that could mirror that. And you could seek legal advice on how best to make sure that you're covering that off. But the language is clear that it's non-unionized staff only.
Okay. And so then same question, will the province provide the employer the forms or should the employer create? Please don't create any forms. The province will be providing them and they should be challenging enough. So please don't do that. I'm going to read the question and ask Jane to answer this because she might understand it better, the process better than I. How will the lump sum payment be managed across more than one employer? Who would be deemed to be the primary employer for the purposes of the lump sum payments?
My understanding it will be covered by the primary employer, and I wish I had my notebook handy, but it falls to the primary employer, and there's a process to navigate it across between the employers, and I'm not sure what that is, but the default is to who receives the majority of the service to pay for that lump sum.
Jane, your sound has gone off.
Oh, it's the employer, it's the primary employer for the purposes of the lump sum payment will be paying it.
Oh, you're back.
I'm back, there I go.
Absolutely.
My understanding is that the primary employer will be there for the purposes of the lump sum payment. They will be the people who shoulder that. There is a process to navigate that. I don't have my note handy to say what that is, but it does default to who derives the greatest amount of the individual's service. So I'm not sure that they've articulated the process for the reconciliation yet, but there will be a process for that.
Okay. So the next question is, I'm going to skip over it because I've already answered it. Next question, and it's a good one. We have redeployed dental hygienists to perform swabbing in long-term care. Are they deemed eligible under the role of screening? In putting that question, if they were in a public health setting, the answer would be no. But under long-term care, don't know, and they may be actually eligible in that situation, but that's the answer. That's where you need the Ministry of Long-Term Care to answer whether those redeployed staff that are doing frontline work are under their program for pandemic pay. Okay, will funding go for emergency shelters be given to the municipality to distribute or go directly to the agencies? Again, it's our understanding is, actually, I'm not even going to try that one. I think that's one, and that's the Ministry of Municipal Affairs and Housing. And so I don't know exactly how that is going to flow. Look for the details that will come out next week. And again, as new information comes out on pandemic pay, we will continue to do it in our updates for AMO. Jane, do you have an answer to that one?
No, I don't, but I wanted to go back to the previous question because I just looked up my notes, and employees who work in multiple facilities will have to attest that they worked for 100 hours. So there will be a form for an attestation in order to draw that funding.
So, so again, on the wrong email, just tried the email, said it was the wrong email, please repost. So the answer is, I will admit to being dyslexic. I will admit to doing these slides late at night. So it's possible, and if so, I apologize. We will double check the email before we post these slides. So thank you for the person, Mary, who followed up on that. Should the additional hourly rate apply only for specific hours within a day? I'm not sure. Jane, do you have it's for the hours you work in the eligible workplace for the eligible position.
I think it's the same message as if you're a dietitian for 2 days a week and a manager for 3 days, you're going to have to keep track of what hours you do what in what role. So those will be the hours that draw it. And when the reconciliation process, if it's a little fudged, it will get caught. So people need to be very vigilant on keeping track of their hours.
And that's the thing, there will be a reconciliation process that will need quite probably, it will be a process that satisfies both the provincial Treasury Board guidelines as well as the federal Treasury Board guidelines. So there will be reconciliation, which is one of the reasons we're saying, again, look to the forms that the province sends out. They will give you the directions. But if they're saying the person is not eligible, you may not want to pay that person because you will not get the money. Have you received any sense of timeline? Again, Jane went through the timelines. We understand that they'll start to flow, they being the province.
Next week.
Flow the information next week, the funding the week of the 15th, and then they're saying to the employer to send the money out. So soon, it's coming. Again, check the timelines. That is actually one of the places in the provincial website that has changed a fair bit in the last few days. Good question. We're in a county that manages EMS through a contractor. Will we receive the money or will the contractor? It will flow through your transfer payment agreements. There, no new agreements will be set. So if the money is if the TP arrangement is with the contractor, it will go straight to the contractor. If you, as the county, get the money and then you flow it to the contractor, it will go to you. So again, it follows the line of who they work with through their transfer payment agreements. And so we have redeployed non-management staff to support employees who are in a temporary housing isolation. I don't, you're going to have to ask the province. That's very specific, and I think it's more they're looking for person. They're looking for more public-facing frontline work. I'm just sorry, I've lost my place. Oh, there we are. Will the province contact the employer directly? Yes, and that was one thing that we did put out as the update, is that by contacting AMO and OMHRA, that seemed to cover, you know, they contacted municipal employers, and that's what we sent out in our update, which is another reason we're doing this webinar. But those that hold the license or the TP agreement license, by that I mean the long-term care or the TP arrangement, you will be contacted by your program area. So again, 3 ministries, 4 programs. You will be contacted by each one of those programs. We're hoping it's an integrated process, but that's the way it's going to be. And does the pandemic pay apply to employees deployed into these eligible jobs and workplaces? Again, it depends. If you've been redeployed, if you're an inspector, a dental hygienist in public health, and you've been redeployed to swabbing, the answer we've received is no, but that may be different in long-term care. Again, they've been fairly clear in paramedics. It also looks like there is a more scope under housing and shelters, so it depends. Thanks, we're trying to keep up with the responses. And so, okay, so here we go. A municipal organization that operates non-urgent patient transfer service for the movement. So interfacility healthcare, not paramedics, but are transporting. So the answer we've received by the province is it's only for those that are primary or advanced care paramedics that are doing 911 calls. So the answer we understand is no, not if you're running a non-urgent health facility. Okay, what about redeployed employees that are not in a qualified substantial positions, temporary health? So again, if it's redeployed, you're gonna, each one of those programs is gonna have to tell you how they're dealing with redeployed employees. We have not been told that this is the rule for all of the programs for redeployment, and it depends. So I'm gonna just read this and then send the next one over to Jane. How is overtime for eligible employees to be treated? Is simply considered an additional hour paid at $4.
So I would suspect, I don't have clarity on this, but overtime would be paid, and the overtime hours that are worked would be paid, would qualify for that hour because it is hours worked. So your overtime would be your time and a half, and then the $4 would be added to that because it is an hour worked. That would be what I would anticipate would be how it would be paid.
Okay. Next question is also for Jane. I can't recall the exact wording, but there's reference that the $4 includes the employer share of payroll deductions. This is in reference to CPP, UI, and EHT. Does this, if so, does this also mean that the employee would be receiving something less than $4?
I don't know the answer to that. What they have said is that the funding will include the mandatory benefits How they administer that, I can't tell you at this point in time. We'll have to see how it actually gets administered from there, but it's a really good question. I'm sorry, I can't answer that.
Next question, can we assume our full-time employees default will be our primary, or do we need an attestation from them? Jane, again, I don't think they've answered this question yet.
So if what you're asking is that if you have full-time employees, the default be our primary, I would say that as long as they are full-time employees working for you, not working for someone else, you will submit your reconciliation form. If they are full-time with you working part-time somewhere else, and that is what, like they'll already be over the 100 hours if they're full-time working for you on eligible. So it would be up to you to reconcile that. If they're somehow making their 100 hours between two employers, the default would be the primary, and the employee will have to attest that they've worked 100 hours.
Next question is, and again, this may just be different language, but stated the primary employer and the home employer will pay the monthly lump sum payment. Please confirm this is the same employer. Jane, again, it's just the one who has the staff person for the most is deemed to be both the primary and the home, right?
Yep.
Okay. Okay, so Sandra says she asked the Ministry of Health about public health employees working in long-term care and if they would meet the long-term care criteria, i.e. Public health inspectors doing infection prevention control or nurses doing swabbing, and they said that they would meet the long-term care criteria. That's our understanding as well. All we were trying to say is in public health, they wouldn't if they were redeployed. And sorry, we're starting, I still see a few more questions. Any suggestions about how to treat a shift that starts before or after the designated periods?
So that's back to the payroll question of, we've asked if there's a way to deal with those, weeks that are before and the part pay periods. At the moment, we've been given the reconciliation periods from the province, and we've asked them if there's flexibility to deal with it. So hopefully they'll come back with recommendations, because we said aligning payroll periods across the province isn't conceivable under the guidelines they've given us for those timeframes. So we're hoping that they'll provide clarity. Right now, they're asking for reconciliation to be those periods. So there may be a week at the front or the back that doesn't end up getting covered unless they change the criteria.
Okay, so another question for you, Jane. Will the additional 4 hours and $4 an hour in the lump sum payments be applicable for vacation pay and stat holiday pay?
And I am going to have to ask someone from payroll about that, because I would say that as it's being treated as supplementary payments, it would not be. That would be my best guess, because they're treating it very distinctly as more of a premium pay, which does not fall under the eligibility for vacation pay and stat holiday pay.
Okay, thank you. And again, I see that a lot of people are asking questions in the chat. We're moving through the Q's and A's. If we still have time up until 1, we'll try to do the chats as well, but I think we're answering many of the questions, so we'll keep going on this. So again, this is redeployed staff from other areas to our long-term care, an accounting clerk going to the home to assist residents, and their non-management. Then they're non-management, so the question is, are they being exposed to patients, and are they doing a position that's eligible? So both those criteria need to be met to be able to answer, to be eligible. So if a paramedic works part-time for 2 employers, who is deemed the primary employer? Jane?
Same answer. Right? It's where they do the majority of their work. Where it gets into problems, if that's flexible and that some months it's, it's this municipality and then another month they work most of their time in the other municipality, that could change the default, but the attestation would be that there's 100 hours and the employers have to validate that.
So another question from an anonymous person is, do we start paying now and recoup, or wait till those funds are sent and then pay? Answer, don't start paying until you get the money, till you get the forms, till you get the fine detail. And if I understand it correctly, I think they're going to be sending the money to you in 2 tranches with their best estimate of how much you need at the front, and that will be the funding that flows the week of the 15th. But if I may, don't start paying till you see the whites of the eyes and such. And a question, it's their understanding that pandemic pay would only flow to a public health unit that's in a deficit. If we are in surplus, is there no incremental funding? I would say that, Glenn, that is not accurate. This money is being sent to all of the 34 public health units for those staff that are eligible, which are nurses, designated nurses doing frontline work with possibly COVID positive people. So it has nothing to do with whether you're in deficit or not. Given all the costs to COVID right now, I think everybody's in deficit. So, so thank you for asking that question. Is this pay owing to people who have since left our employment? And the answer would be yes, if they go back to April 24th. And
I agree.
And paramedics conducting swabbing in assessment centers, I believe that is eligible because you're a paramedic and you're being exposed. I'm very sure, but again, look for the confirmations. Again, same question for employees with multiple employees. How do we determine who's responsible for the $250? And sorry, someone's pop-up has just so sorry, pop-ups just clouded my vision there. Sorry, and it's going down. So again, Jane, I think that's where the employee has to say who they work for.
Yep.
And then the employee has to do an attestation.
Yep.
What if you already paid a premium rate to emergency housing frontline with COVID positive clients until May 1st? Will the pandemic pay be on top of this premium, or will we deduct the premium rate from the pandemic pay? That's a tricky one because again, the advice, everybody, if an employer chooses to pay extra, as long as you've got proper designation and approval, but my understanding, and I'll check with Jane, is this is money separate from that. This is a provincial federal program. Jane?
Yeah, I mean, I think it depends on how you've characterized it. If you've advanced it, then you have a payroll reconciliation exercise to do. If it's a different type of premium, then they could draw this, but I think you have to look at how it's been characterized. If you did the $4 and it was basically you advanced it and it's within that post-April 24th period, I think you're going to be getting the money so that you're essentially reimbursed for what you've already paid out. And bear in mind, this is you paying it to these people, so the province won't be paying them directly if that's the confusion. So it will be just, you will be made whole for what you've already paid out. There won't be something supplemental.
Okay. So have another question about EMS logistic technicians who clean, sterilize, and restock. Again, our best information is no, these folks aren't eligible. At the same time, the province has shown it can hear us and make different decisions. So wait till you see the actual language, but our best understanding is no. Jane, you wanted to?
Yeah, the other thing I would say is if you are a paramedic service where the paramedics do the work of doing that cleaning and logistics, that's different than where you have logistics staff. So it's the title of paramedic that draws the payment. So not the work that they're doing necessarily, but the paramedic role. So where that gets a bit muddied is if it's an accommodated role that they're doing that work of logistics. But if they're doing paramedic work, but as part of normal paramedic responsibilities, they would likely draw that payment. It's where there's a division and there is a distinct role to do logistics and an accommodation they're doing it, or you have logistics staff, it would not draw that payment.
So just have a couple more questions. So one of the questions is, heard that individuals would need to apply themselves through an online platform for the lump sum payment. No, the answer is no. The employee does not need to do anything other than get this money flowed through the employer to them. So no, there's no online platform for this, and all the information will be coming through the transfer payment agreements to the employer. Next question is a PSW in a long-term care who's on a WSIB claim doing modified duties. But again, activities include screening and personal care. Are they eligible? So in some cases, they say if you're on modified duties and you're on WSIB, it's not. But again, if part of their the accommodation is doing screening, damn good question for the ministry to answer. Jane?
And I think I would ask, those all look like roles that could be incorporated into the normal work of a PSW. So I'm not sure it would be differentiated, right? So it depends on what you define the work of your PSWs to be. So if they don't normally do that, but it is PSW work, you probably want to get clarification on the eligibility. But those look like tasks that very often are done by PSWs. So I would seek clarification just to make sure, because I think that one would really depend on what the normal work of your PSW would be.
The next question is the $64 million question. Define management. Yeah, we've been trying and such. And the question that David asked, it's unclear whether we would include our supervisors who are both union and non-union who manage employees, and both have their advanced and their primary care paramedic certification. I will tell you, we have asked that question and we have been told it doesn't matter if they're union or not union. If they are a supervisor and manage employees, they do not qualify. Jane, that's your...
Even if a portion of their regular job falls into doing the work of a paramedic, that they would work in a two-person vehicle and they're one of those two people, even if they're a unionized supervisor, there is that element of distinction that they're making that they cannot be included. There are some services in the province where they actually have unionized supervisors who work as part of the team. They will not be deemed eligible by the province, is our understanding.
At the same time, we've asked that question an awful lot, and I think that, again, this is our best understanding as of 11 o'clock today, based on the materials the province has provided. So next question is, they've heard some employers are already paying pandemic pay out to their staff. It may be true, I've heard the same thing. Our question is, our comment is, please have really good records, because the challenge will be in the reconciliation. I can't speak to municipal housekeepers that have been redeployed to assessment centers. If they're exposed and if they're in a long-term care, they might be. And again, the next question is understanding of a maintenance staff working in a social housing unit. Again, you need to press the province on how they define maintenance staff, and remember it's a maintenance staff person who has a risk of exposure. So that may be the defining. And Jane, I don't know if we could possibly answer this. Will need to be reported on a T4 in which box?
It will need to be reported on a T4 because it is earned income. We will receive clarification from the federal and provincial government on how this is going to be recorded.
Next question from Anonymous again. I'd like to meet Anonymous. We have paramedics doing community outreach with homeless population. Would this fit under the housing program, housing and shelters? Good question for them, because again, it wouldn't be under the paramedic services, but rather the housing and shelters. But again, check with them about eligibility. What if we want to provide our own top up for positions not recognized by the provincial program? Is there any concern? Well, the concern is the precedence and what you choose to do. Again, every municipal council makes their own choice. The challenge is if one municipality chooses to do it beside another, then you've got equity issues, and this is a provincial program. But so yes, every municipal council can make their own choices. It just does have a cumulative impact and pressure on councils councils to do the same thing. So that continues to be a challenge for municipalities when provincial programs roll out. And the next question, again, will the hourly pandemic rate for overtime hours worked be $4, or will that also be needed to be calculated at time and a half? And I think, Jane, you answered no.
Yeah, the $4 premium remains the $4 premium. They're not going to get $6 if they're working overtime. A $4 premium is a $4 premium. So what they get is their regular overtime rate would be their overtime rate with that $4 premium on the hour worked, would be my speculation.
So it's 1 o'clock. We can't do what's in the chat box right now. I think we've answered to the best degree we can, and just know that we've just providing information as AMO and OMHRA for a program that is going to be rolled out starting next week by the province, 3 ministries, 4 programs. I joke what possibly could go wrong with that. But we're just trying to do this basically as a public service to at least try to give you as best an idea of what's coming for those of you who administer these programs. So
I would also say it's important for people to know that if you think you've missed something and that you should know something, chances are you didn't miss anything. We just don't have it yet. So, what you don't know because it's probably not there, because the information is out there. It has changed, right? I think one of the biggest issues every unit is going to have is that the original description of this program seemed far more generous and set an expectation, particularly for public health nurses, that this would be a very different rollout, and that as the parameters have been tightened up, managing expectations will be incredibly difficult for employers, because I think there's a lot of people out there who think they're going to be eligible, and understanding the why that they're not eligible, particularly when I think of paramedics and logistics staff, right? Logistics staff are cleaning ambulances that have had COVID patients in them. So it's very difficult to differentiate that. So we really feel your pain on that one, and we're hoping that more and more clarity and, bluntly, a little bit more generosity and breadth would be beneficial for employers.
So just to sum up, we have really tried to raise these issues in any conversation we've had. We will continue to try and provide as much information as we're able to share what is public. The AMO updates go out virtually every day. We will continue to do that. They're always posted on our website. I will make that check in the slide deck to make sure I did capture the right email, because we want these questions to go to the province. They are the ones that are doing the eligibility. They need to answer it. And that's again why don't shoot the messenger. There are going to be people that are disappointed with this program. At the same time, it is over, $287 million. We want to make sure that it goes as well as possible. So thank you all. Really appreciate your participation.
And we'll go through the Q&As. I think having looked at it, there's a lot of duplication, but we will check the Q&As to see if we need to supplement.
Fair enough. Thank you.
Thanks.